What is going on? Welcome back to one of our red pill versus the blue pill episodes. Hope y'all are doing great. It's a beautiful day out. It's perfect. It's perfect outside. Can't wait as we dive even further into this matrix we call our healthcare system. I'm Dr. DeLon Canterbury. I am the founder and CEO of GeriatRx, as well as the Deprescribing Accelerator. And I'm here today discussing, of course, the usual deprescribing in seniors and how we can better advocate for the over-medicated. So hope y'all are doing well. This is our weekly series where we discuss the red pill versus the blue pill. If this is your first time tuning in, I appreciate you. But the red pill versus blue pill, The Matrix is my favorite movie of all time, if you didn't know. So I think it's the perfect metaphor for our healthcare system. And it is exactly why I created this series where I feel we as clinicians are kind of just stuck in this foggy matrix we call healthcare and aren't awoken to our key skills in patient advocacy, senior care, and of course, leveraging deprescribing and using that as the standard of care for our seniors. And I think we're just stuck in this business stakeholder driven ecology we call healthcare and aren't putting in more funding for preventative resources to help people manage some of these chronic conditions that are unfortunately costing the patient thousands of dollars a year, but worse yet, our health system and we as taxpayers are paying that as well for preventable medical harm and medical errors, all because of too many meds. And so I'm Dr. DeLon Canterbury. I am a geriatric trained pharmacist, as well as the founder of the Deprescribing Accelerator, which is sponsoring today's program, along with GeriatRx. And my job is to be Morpheus. It is to show you the way out of this heyday or this 9-to-5 world or this whatever we call healthcare matrix. It's a maze, and show you the way how deprescribing not only changes our lives for the better, but our patients for the better. It gets our passion back as clinicians. It addresses the need that our senior care space is sorely lacking because we do not have enough drug experts working in geriatric medicine in the older population, period, right? We're losing doctors left and right. We're losing geriatricians, which is even more rare. It's 1% of the provider workforce of physicians. So I see opportunity for sure for pharmacists to take the realm, for people who work in consultant pharmacist roles, for geriatric pharmacists, whoever trained, AmCare. You're going to be the ones that they're going to go to for their care. So if you are not equipped and prepared to treat this population, then hey, we're going to have bigger issues than medication harm now in the next 10, 20 years when I become a senior citizen. So that is on my mind. And so today we're discussing again opportunities to leverage yourself as a deprescribing advocate, as a deprescriber, whether you're a pharmacist who's just passionate for better medication optimization and safety, whether you're a nurse who sees time and time again, if you're a visiting angel or LTC nurse, to me, the ego doesn't matter. The title doesn't matter. Of course, pharmacists are drug experts, but people who touch seniors and have to work with the meds and see how they are functioning day to day, we all have an active role to play in deprescribing and using deprescribing as the tool to advocate, and not just advocate, lead to better health outcomes, because we gotta put an end to the costs that we are wasting from over treating patients. It's It's a cycle that needs to stop. So I'm tired of prescribing cascades killing people. I'm tired of polypharmacy killing people. I'm tired of medication side effects killing people. And as a pharmacist, you just kind of get burned out filling these pills over and over and over with people who are on 20, 30 med lists being sent to the ER, but worse yet, being sent to an assisted living facility. And then they're maintaining the same meds until they get so sick, they end up in hospice. And then hospice finally decides, you know what? Let's stop the meds and see what happens. And then you stop the meds and you wonder, why is the patient getting better? And I hear that story too often, particularly on the winning side for those who were able to deprescribe their loved ones and reduce those med lists. And what do you know? They, quote unquote, graduated from hospice. I'm going to start using that. I learned that today after speaking with someone who was a nurse and managed to advocate for her mom, who was dealing with, again, overprescribing. So there isn't really a boogeyman here or a one end all be all for why this happens. This is a systemic issue, again, hence us being in this healthcare matrix. And my job as the chief deprescribing implementation strategist is to simply be your Morpheus and show you that you can choose the red pill. You can unleash your intrinsic ability to be a deprescribing advocate to, well, save some lives, all right, and prevent harm. And not only that, but also save some insurers money too, because, hey, they don't want patients sicker and they don't want patients falling and going to the ER. So it ends up being a win-win-win. The patient wins, you as a clinician wins, and our big payer insurers win if their patients are healthier and aren't, of course, falling out and dying from benzos or opioids or antidepressants or antipsychotics or any drug that's working a little too hard for what it should. So I think that's a good synopsis of why I'm here today. But let's be real. Today we're talking about the perfect opportunity for deprescribing, and stumbled upon it probably a year into starting geriatrics in 2020. And it was simply by public speaking and doing educational events for nursing homes. And I would do them specifically for their retirement living communities or independent living communities. You see, there's a whole world of different types of nursing homes and assisted. There's a lot of stuff, and there's differences and nuances to each setting. But you and I both know that some of these places already have their own like long-term care pharmacy embedded, or they already have like their own slew of consultant pharmacists managing, I don't know, 50 to 100 beds per pharmacist, whatever the case is. Not all of them are like that. But we are missing out on an entire community of older citizens, 60 and up, who are in these independent living communities, right? And no one is thinking to go in and just work with them as a pharmacist or as a deprescriber or as a nurse who's passionate about deprescribing or holistic meds. These facilities literally have $1 million budgets and have vendors that come in. They can do anything from diabetic durable medical equipment to a speech therapist. They have chiropractors sometimes they contract with. I mean, there are all types of chefs that are like featured. Like, there are tons of people that work in these settings. So why aren't more pharmacists and nurses? I don't mean as staff. I mean providing a whole different service. Okay? Yeah, no. Switch it up. We're switching it up today. I'm saying come in as the expert and sell your service. In my world, is deprescribing and genetic testing, of course. But I didn't just know this was available. One, I had to figure out who to go to, who to market this to, why would this matter? Is it even valuable to them? And the answer was a resounding yes, as I started doing the first thing that got me into this world, which was my Drugs with Dr. DeLon series. So I'm curious how many of y'all remember that last year, but 2021 was the first time I launched a 4-part bit virtual and live series. And it was essentially covering everything from the activities of daily living. So basically, how do you know when your loved one needs help around the home? Knowing some of those signs, it could be hygiene, getting dressed, getting lost very easily, just noticing any differences in your loved one's behavior as a potential red flag or indicator that maybe they may need a little extra help at home. So that discussion I gave talked about activities of daily living along with the instrumental activities of daily living. So, balancing a checkbook, doing laundry, like kind of just things around the house. And so giving a talk about that was a great segue into, one, putting my brand out there, two, talking to people and educating them through empowerment and being aware of what some of these signs are. Three, improving their quality of life, so now that they can ask questions and hopefully stop any potential harm or side effects that may occur. But it wasn't just activities of daily living. During this time, COVID was just starting. So we were discussing COVID. We were talking about misinformation, vaccination, how the vaccines were made. So it wasn't really all about deprescribing. It was, again, just showing up and serving and educating our communities. And so I'm based in Raleigh, North Carolina, in Durham. I'm in Durham. And so I would reach out to all of my area wellness directors. I would reach out to all the area offices on agency and aging. I would speak to them and say, hey, I'm a geriatric pharmacist. Would your community find value in me just doing a talk about XYZ? And so I started just pitching the Drugs with Dr. DeLon series, right? And that was my way to get in to these facilities. One, to build a continuous relationship. Two, because now they're seeing me every month. I'm on their agenda. And now three, their patients know me and love me, right? So I'm building upon all the know, like, and trust factors, but also I'm getting paid to do that. It wasn't all free. Some of them, I'd volunteer my time with, but most of those were paid contracts, right? Which is great because, we got to get paid for what we do. We're experts, got to get paid. So even in doing all that, you learn a lot more about the operations a bit. You get to kind of get a feel for how some of these organizations work, how they get things done, how they motivate their residents, how they engage them, how they engage staff. And so I started learning a little bit more behind the scenes and getting comfortable with some of their directors of wellness or their nursing leads. And now, mind you, I'm in the retirement living independent space. I wasn't necessarily like teaching to people who work in like assisted living facilities and skilled nursing facilities. That's a little bit of a different world, and they tend to keep things in house, and that's a little harder to break into. So if you're going to try to work on selling a service or working on at least considering training their clinicians, it may be worth that. But I'm talking specifically about the retirement living setting. And so in that setting, I give my talks. I will talk about pharmacogenomics, of course, perfect opportunity to talk about genetic testing. Even one of them, it was so crazy. Well, I was at the Cardinal in North Hills, and one of their participants within my talk was like a geneticist, like OG geneticist, right? Like studied this in the 50s. Like he was an original geneticist. He was like, wow, he loved talk, but he literally echoed what I was speaking to. So it was great having someone in the audience not only know what I'm talking about, but also study it and can attest to the utility of it. But this was so cool because not only was I getting paid to just give my Drugs with Dr. DeLon series, but it gave me the lens of what, of course, my ideal clients are dealing with. And they were dealing with being over medicated, right? They were on actually a good, it was kind of half and half. Like, I was pleasantly surprised that a decent number were on fairly minimal and some were on tons, sure. So it was a mixed bag. I'm not going to say all across the board everyone was over medicated. That wouldn't be fair. But there were some that would definitely raise their hands, and you could tell by the questions they were asking. Well, what do you think about this drug? Should I get off this? And you get a good dialogue going. But that was some of the more interesting observations. But a lot of my audience liked the idea of genetic testing. That was super niche to them, very new. They weren't really explaining what it does. Not really much pushback, but not only was I able to get potential clients and leads from using these simple webinars and demonstrations on what a basic stuff a pharmacist knows. It wasn't even like in-depth stuff. My speaker series was on COVID, like vaccination misinformation. It was on activities of daily living. There was one, of course, on pharmacogenomics or genetic testing. And then there was one on, of course, drugs with dementia. So basically, what medications do you want to avoid if you suffer from cognitive impairment, right? So just a lot of pictures and just speaking about OTCs and certain potentially inappropriate meds, literally just basically spilling the beers list in a very easy to follow form. And my gosh, the questions would just start booming, right? They would just start coming out of nowhere with everything. And it was great because I'm getting engagement too. They are now learning in the process because they're actively listening and they're actively asking questions along the way. So I get a little bit of a mini quiz on what's harmful, what's not, or what they can consider as an option. But it was fun because now I'm getting intel on what my patients or prospective patients would need. And now I'm getting contacts, I'm getting leads, and I'm having follow-ups, and I'm able to schedule future med reviews, right? So Deprescribing is absolutely a gold mine within the senior care space, but I don't want us to just assume all because they're in a retirement living community that someone isn't actively looking at their meds like this. So don't just think, oh, they already have a pharmacist on staff or they already have someone watching them. Like, no, you can't assume that. They just live there independently and they're paying a lot more money to have the convenience of being in that network, but they're honestly mainly on their own if they're in that retirement or independent setting. So again, for someone who hasn't worked in this space directly yet, until I started this business, I wasn't quite aware of all the different types of settings, but it became a gold mine and it became great. So now not only am I building relationships with people in different nursing home communities, but now I'm being invited to their health fairs, right? Now I'm being invited to their networking events, right? With other physicians. And guess what? Other people in the senior care space. So I'm now seeing more opportunities to now share more of the Deprescribing mission just from actively showing up and just serving. And I got paid to do that, right? I got paid a contract for that. So not only was it about, it's not about the money really, it's about, again, serving people authentically and leveraging what we already know as clinicians in the senior care space and putting it in a very easy to follow and digest manner. And so that is why Deprescribing is absolutely a gold mine, one, for our seniors, but more importantly, within these types of settings who honestly have a lot of their meds pre-packaged and blister packed and probably mail ordered. And can't lie, there isn't really an incentive for people who use outsourced pharmacies to stop all the meds as much as possible. I mean, some in the more stringent long-term care setting, yeah, they're going to be dinged if they don't hit certain metrics. And so those metrics are good, like reducing antipsychotic use in seniors and dementia, like inappropriate opioids. Those are great. I want that to happen. And when it happens right, it's brilliant. It's amazing, right? Because now you got all your geriatric patients on 3-4 meds, if that, and that's ideal in this world, but not always seen, nor always commonly seen. So the community resident I think, is one of the biggest opportunities for pharmacists, nurses, and social workers who are considering the deprescribing world in advocating, right? There's no need for us to wait until they hit hospice. I'm going to say that again. There's no need for us to wait until someone is forced into hospice, and now we start talking about getting them off of drugs. I cannot express how many anecdotes I get where someone goes to hospice, they stop the meds, and they get better. And it's not all of them, but I hear it so often. And that's where I heard for the first time earlier someone graduating from hospice because they went back to the community. They went back to their lives. They were about to and don't get me wrong, not all people who go to hospice are like meant to die. That's a misconception. There are different reasons and meanings and life terms, so to speak, for hospice. Like how long you're going to need to be in there may vary on the reason, and it's okay for it to be temporary. But the truth is, I hear it way too often. So I'm like, okay, if I keep hearing this, why not have a senior-facing retirement community literally have a deprescribing mark of approval that says, you know what, we incorporate a deprescribing mentality here, and we are going to make sure our patients are empowered about these meds. And they contract with, I don't know, GeriatRx or Delon or all the above, whatever. But this is my vision. And this is how I know that there's going to be a need, because the patients want more, and they want it for their loved ones, and they want it for their family, and the caregivers want it. No one wants to see granny on 30 meds. No one wants to see someone almost sent to another more intensive memory care unit because of something preventable like medication side effects. And so this article came out again last week, or in Drug Topics, speaking about the doubling and the increased rate of adverse related events in seniors across the US in just the last 4 or 5 years. 4.2 out of 100,000 people are going to have some type of medication harm. That was 4 years ago. Now it's 8.4. That's significant. In just like 4 years, that's a significant increase in people potentially being hospitalized because of a medicine. And I'm sick of it. But that spells to me opportunity. That spells to me, yes, a reshifting of our medication mindset, of how we, reduce this knee-jerk trigger reaction that we have to always prescribe something. But more importantly, our seniors are living longer. So why subject people to harm if we can avoid it? And that's why the Deprescribing Accelerator is completely tailored to address that very core issue and learn how to monetize that. So senior facilities who are leveraging this type of work are not only going to be improving patient satisfaction and quality of care, but they're going to also be improving patient retention. People are going to stay and live longer if we're reducing harm. What that means to these type of organizations is someone is going to be paying that check every month because they're not worried about filling beds. They're healthy enough. They're living well. That's going to be good for your bottom line. And this is just speaking from a retirement living community, because I'm not big on the bottom line for just bottom line's sake. I'm just speaking to what they are going to see the value in, but we haven't gotten there yet as a society and as a health system. But I think we'll get there. We'll get there, maybe. I don't know. Healthcare is a business. But either way, patient retention, quality of life improved, right? in some instances, hopefully, if there's less opioids and less Xanax being used in seniors, we're going to have less falls. We got less falls. We got better patients. We got better quality of life. We got better reimbursement rates for people that are helping people in these more intensive, like SNF, ALF, assisted living facility, or skilled nursing facility communities. Because those measures, those HEDIS measures, are what they get paid by. And the better they are, the better the reimbursement. And of course, hopefully that means the better the patient's life is. And I think for the most part, it is for the better. So we are so quick to see it as, well, I don't see the concrete value, and I don't, where's your data? Bro, if we had that, we have decades of data. We have decades of data, and we don't really act on it because medicine takes like 30 years for us to change practice, even though the evidence is in front of your face. Not to mention, stakeholders don't quite care about the value of the people. It's more about the value of the bottom line. And that's the issue, is we need to reshift this, again, matrix, and fix the root cause of our issues here. So deprescribing is the perfect opportunity when it comes. Hey, Kaya, what's up? It's the perfect opportunity when it comes to our seniors. One, two, if you're looking to start selling yourself, or at least as someone who has a passion for this, you got to start where people are. And nursing homes were one of the easiest opportunities for me. I created an Excel sheet with like, over 40, 50 different locations within the Raleigh area in like a 40, 50 mile radius, and called every one of them up. Yeah, this was in the beginning. It was cold calling and introducing. I can't say that's always what I recommend to do, but again, when you don't know what you're doing, you're kind of just flinging your way through the dark and seeing how you can best serve people. And that's what I was doing in the beginning. So needless to say, I eventually learned how much opportunity fell into my lap just from being able to be in the room. And so that's led to strategic partnerships. That's led to me being invited to private networking events with fellow senior care providers who are in the caregiver space, physical therapy space, holistic nutrition space, speech therapy, audiology. I mean, my network has grown exponentially. And guess what? Now that they know what I'm doing, I'm being invited to other events for their organizations to speak and do the same thing. Again, patient advocacy, stopping harmful meds, and leveraging my profession as a pharmacist in the way that aligns with my passion and spiritually. And I mean, I'm happy. I love my life. I am freaking happy. And I can't see it any other way now. So this is why deprescribing means so much. I mean, it's really a movement, not just in socially conscious entrepreneurship, but it's literally what I feel we in this space were meant to do. Like, I literally feel this deep-rooted community-based advocacy needs to be like at the crux of all we're doing. And I want you with me. I want this for you. I want this joy for you. I want this passion for you. I want you to see that it's not a myth. Deprescribing isn't a fairy tale. It can definitely be monetized. We don't have necessarily CPT codes for it, or ICD-10 codes for deprescribed candidates, but there are ways not just around that, but there are ways through it, and there are ways that we can do it as a team. And I cannot stress how much being exposed into this world has led to other amazing opportunities and lead generation for prospective clients in need of my services. So anyway, deprescribing has been so fun, and hopefully this sheds some light on how my humble beginnings, and they're still humble, trust me, have taken me to where I am today. And this was, mind you, all just last year. So I'm Dr. DeLon Canterbury. Again, appreciate you tuning in to the Red Pill versus Blue Pill. Thank you guys for commenting and sharing some love. But let me know what resonated with you. Let me know what you may be thinking if you're in the caregiver or patient advocacy space, or again, if you're a geriatric pharmacist, geriatric nurse, geriatric prescriber looking to do something different. I encourage you to check out our Deprescribing Accelerator. We have the link in the comments, of course, and you can apply for our next cohort, which will start next year in 2023. So you guys take care and see you next week. Just so you know, there'll be a couple of conferences I'll be attending. So next week I will be actually at the American Society for Consultant Pharmacists. So check that out. I'll be in San Antonio next Thursday. So I think I land right at 12, so I may have to tweak the time, but I'll let y'all know when we show up next week. All right. You guys take care.